Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about the importance of screening for cystic fibrosis before or during pregnancy. Cystic fibrosis, CF, is a genetic disorder that causes digestive and breathing problems. The body produces sticky mucus that builds up in the lungs, pancreas, and other organs. Those with the disorder are usually diagnosed early in life. Treatment focuses on managing thick mucus, proper nutrition, and preventing infections. Medication, chest physiotherapy, and exercise are important in treatment. In 2001, the American College of Obstetricians and Gynecologists, ACOG, began recommending cystic fibrosis screening for those with a family history of CF, if one partner has CF, and couples in which both partners are Caucasian. You and your partner can be tested before pregnancy to determine if either of you are carriers. Medical experts urge Caucasian couples to have the test because it's the most common birth defect in this group. Screening is also recommended for others at high risk, such as Ashkenazi Jews. Preconception screening for cystic fibrosis may be offered as part of genetic counseling. The CF screening test uses a blood sample or a saliva sample to test for the disease. Test results are usually available within 8 to 21 days. A panel that screens for 23 CF mutations is the recommended test. Another test, the Cystic Fibrosis CF Complete test, can identify more than 1,000 mutations of the CF gene. Current tests cannot detect all mutations because researchers don't know all of them at this time. However, unknown cystic fibrosis gene mutations are rare. For a baby to have cystic fibrosis, both parents must be carriers. If both parents carry the gene, baby has a 25% chance of having cystic fibrosis. If only one parent is a carrier, the baby will not have CF. A test can be done in the first or second trimester of pregnancy on a mom-to-be to see if her baby has cystic fibrosis. NIPT, a blood test on a mother-to-be, can be done as a screening test as early as 9 weeks of pregnancy and doesn't pose any risks to the fetus. Diagnostic tests include chorionic villus sampling, CVS, around the 10th or 11th week of pregnancy. Amniocentesis may also be used to test a fetus. If you believe cystic fibrosis is a serious concern, or if you have a family history of the disease, talk to your doctor. Testing is a personal decision you and your partner must make. Some couples choose not to have the test because it would not change what they would do during a pregnancy. In addition, they don't want to expose the mother-to-be or the developing fetus to the risks of CVS or amniocentesis. However, testing is recommended so care can be provided to a baby with CF after birth. The benefits of testing can provide reassurance a couple is not at risk of having a child with cystic fibrosis. If results indicate a fetus has CF, specialists will work with the family to develop a treatment plan. Early detection of the disease allows for prompt treatment and management of the disease after baby is born. If you or your partner have questions about the test, discuss them with your doctor at a preconception visit or a prenatal visit. He or she will advise you. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.